Hello, students. This is MA 135, Introduction to EKG. So, EKG was invented by Willem Einthoven. He was a Dutch doctor and physiologist and a brilliant scientist. He invented the first EKG machine in 1903 and received the Nobel Prize for Medicine in 1924. EKG terminology. We're going to talk about electrocardiography. That is the process of recording the electrical activity of the heart. Electrocardiograph is the instrument used to record the electrical activity of the heart. And electrocardiogram is the record of the electrical activity of the heart. It's the contraction of the heart muscle, which is the myocardium, with rate and rhythm, which is the time required for the electrical impulse to travel through the heart. And it's usually abbreviated EKG or ECG. So, is this an electrocardiogram, graph, or graphy? This is the machine that we use here in the lab. That is the electrocardiograph. Is this an electrocardiogram, electrocardiograph, or electrocardiography? This tracing is the electrocardiogram. It's the record of the electrical activity of the heart. Would this be electrocardiogram, electrocardiograph, or electrocardiography? This is the process of recording the ECG, the electrocardiography. So this person performing the test could be called an electrocardiographer. Why do we use it? To collect baseline information to complete during a physical exam, often before surgery to assess the cardiac risk during surgery or find any underlying cardiac disease. Definitely to evaluate symptoms such as chest pain, shortness of breath, dizziness, or palpitations. It can detect an arrhythmia or abnormal heart rhythm, and it can detect cardiac ischemia, which is inadequate blood flow. It can diagnose damage from a myocardial infarction, which is a heart attack, can determine presence of hypertrophy, which is enlargement of the heart, can detect myocarditis, inflammation of the heart muscle, and it can detect pericarditis, inflammation of the lining of the heart. Assess effect of different drugs on the heart and determine the presence of electrolyte imbalances, can assess progress of rheumatic fever, and detect congenital heart defects. The limitations are it is often used in combination with other things to obtain a complete assessment of cardiac functioning because it cannot detect all cardiac disorders. It cannot always detect impending heart disease or predict the future. It only records about 10 seconds of the heart's electrical activity, so it may not detect intermittent arrhythmias. The test is performed while patient is in a resting state, and a lot of times symptoms do not appear at a resting state. And it's usually used in combination with the patient's symptoms and health history, physical exam, and additional diagnostic and laboratory tests. What is the medical assistant's role? The MA is frequently responsible for recording EKGs in the medical office. So the MA must have knowledge and skill in patient preparation, operating the electrocardiograph, identifying and eliminating artifacts, which is interference on the EKG, and the care and maintenance of the electrocardiograph. Several types of electrocardiographs are available. You can have single channel or multi-channel, and the type used will depend on the specialty and preference of the clinician. Most medical offices use a multi-channel electrocardiograph with 3 channels. The three basic tools that we need to successfully run an EKG are the electrocardiograph, the machine, you need electrodes, and you need lead wires. So the machine is electric or battery powered, and it reads and interprets the electrical and mechanical activity of the heart. The electrodes are sticky pads that adhere to the patient's skin and sense the electrical and mechanical activity. And then the lead wires are connected from the electrodes to the electrocardiograph to allow the information to go from the patient to the electrodes through the lead wires into the machine where it can be evaluated. Electrodes are also known as sensors, and they are sticky with a tab that is not sticky. The sticky part directly adheres to the patient's skin and picks up the electrical impulses given off by the heart. The conducts impulse into the EKG unit through the lead wires, and usually they are disposable, single use. They contain an adhesive for firm adherence to the patient's skin without adhesive on the tab to allow attachment of the lead clip. And the adhesive contains a thin layer of a metallic substance, which is a good conductor of electricity. Metal conducts electricity, right? So in this one, this is the electrode sticky part, and this is the non-sticky tab. Here it is again with an alligator clip attached, hooked onto the non-sticky tab. And usually sometimes they'll have a backing that you take off, like a sticker. And here's the electrolyte and adhesive gel on the electrode, and no electrolyte or adhesive on the tab. So again, they contain an electrolyte gel. That's a chemical that helps conduct the electrical current, as skin is a poor conductor of electricity. They come in a foil-lined pouch to keep them safe from the light and heat. And each pouch usually has 10 cards like this inside. And each card contains 10 electrodes. 1, 2, 3, 4, 5. 5 more on this side. They'll break apart in the middle. The foil-lined pouch preserves moisture to prevent electrodes from drying out, because dried out electrolyte gel is unable to transmit a good EKG signal. So the MA should check the electrode expiration date before applying. Also, you should look at them and see if they're dried out or crusty or discolored, then they probably went bad. You want to store the electrodes in a cool area away from heat and light. And once you open them, cut them open, should store them in a sealed bag. The term lead can have two different meanings. The lead can be the actual wire connected to both the electrode and the machine, or it can also be an electrocardiographic picture of the heart. So we're getting different pictures of the heart during the EKG. Those leads provide different photographs of the heart's activity by looking at the heart electrically and mechanically from different directions or orientations. And this creates a tracing of the electrical activity of the heart between two electrodes. Each lead provides an electrical photograph of the heart's activity from a different angle. So the more leads you have, the better the chance of recognizing abnormalities. So there are different ways to run EKGs with different quantities of leads, but the more you have, the better pictures you'll get, the more pictures. So you can have a single channel EKG unit with only one lead recorded at a time, which gives one view of the heart, and you'll get just a one single tracing. Or a multi-channel EKG unit, which records multiple leads at a time, gives multiple views of the heart, and it's used most often to record an EKG. So this one looks like 1, 2, 3, 4, 5, 6. This is a 6-lead electrocardiograph. Here in the lab, we have 12-lead EKG machines. This is a standard multi-channel, and it uses 10 electrodes, which is why there was 10 per card, and 10 lead wires to give you 12 different views of the heart from 12 different angles. And what we see on the page is a waveform, which is basically a 3D view of the heart. By seeing all the different leads together, you can get a good view of the heart from all different angles. And this helps locate potential problem areas. So I worked with a cardiologist once who would just say, can you get a 12 lead on the patient? So he wouldn't even say the word EKG or the acronym EKG. He just wanted 12 different views of the patient's heart. So you might hear it referred to that. The lead wires, there's 10 of those usually on a 12 lead machine, and they're connected to clips, and then it hooks directly into a hub and then directly into the machine, into the electrocardiograph. Each lead wire has a specific designation and code, which labeled according to where they should be connected. And so you can see different colors here on each one. And then this part here is the connection for a clip. We have alligator clips and we have banana clips in the lab. So hopefully you get a chance to use with both. The alligator clip must lay flat and make good contact with the electrode to get a good quality EKG. Lead wires and clips are fragile, so you want to handle with care. So creating an EKG. You've got your electrodes, your lead wires, the cable connecting to the electrocardiograph with an amplifier and a galvanometer, and the heated stylus. There should be a power cord, but often they have batteries in them as well. So how is it created? Electrodes are placed on the patient's limbs and chest, usually upper arms and calves, and then the chest. You can use the ankle or the wrist instead of the upper arms or the calves. And teeny impulses given off by the heart are transmitted to the EKG unit through the electrodes, to the clips, to the lead wires, to the hub, etc. And the current travels to the amplifier inside the unit, which is required to amplify the electrical impulses because they are very tiny. The galvanometer then transforms the amplified electrical impulses into the mechanical motion, and the stylus, which is a heated pen-like instrument, moves on the thermal paper, recording the electrical activity of the heart. Some machines can be linked with the office computer and go directly into the electronic medical record. Typically, it's wirelessly. It just connects over the Wi-Fi. Or you could actually plug in the machine through a USB port to a computer. And then a digital image of the EKG is sent to the computer, where software analyzes it and displays the result on the screen. And then it's stored in the patient's chart in their EMR. And copies can be printed out as needed. And the report is reviewed and interpreted by a physician. Depends on where you are. Sometimes it might be just the ordering physician. You would perform the EKG and then just give it back to them or send it to them to review. Where I work at PAMF, actually all EKGs get reviewed by a cardiologist, and they make the final interpretation. And when they do that and result it gets sent back to the ordering provider so that they can use the results to diagnose or treat their patient. So the tracing must be interpreted by a provider. I'm going to say provider because not always has to be a physician. You could have a nurse practitioner or a physician assistant interpreting it. And also, in the ER or on an ambulance, you could have a paramedic or a nurse also interpreting the EKG. But for our purposes, we're always going to be giving that result typically to somebody, to a physician or a provider. Medical assistants cannot interpret an EKG, but we must be able to identify artifacts on the EKG tracing, which are irregular and erratic markings on the printout. This is an artifact right here. It's electrical interference caused by the patient's tensed muscles. So again, MAs cannot interpret or result EKGs. We do need to know how to understand them, though, because if you are performing one and the patient's having a heart attack, you need to know what that looks like so you don't just say, okay, you're good to go, and send them on their way, right? So that's what we're going to learn how to do. Minimal preparation is required. If you get the chance to provide the patient with instructions prior to the test, before they're coming in, so maybe they call and say, I need an EKG for a pre-op clearance, or, this doctor ordered one, when can I come for it? If you say, schedule them an appointment to come for it the next day, maybe, you would let them know not to apply body lotion, oil, or powder. That is a typo there. It should be powder on the day of the test, because it can cause the electrodes to come loose, or they won't even stick at all and attach properly. You're going to advise them to wear a shirt or blouse that can easily be removed or even just unbuttoned. And then also, they should not wear tights or leggings or tight pants, because usually they have to pull up the bottom of their pants to apply the lower limb leads. You're going to put them in a room that should be quiet, private, and a comfortable temperature, and also away from any large machinery or electrical interferences. So, important to get a good tracing. The patient should be relaxed and comfortable. You can help them relax by explaining the procedure. It always helps if you ask them if they've had it done before. If they have, then you can just remind them of these points, but if not, they may be very nervous or scared. So you're going to let them know that it's a painless, non-invasive procedure that records the electrical activity of their heart. You're going to place sticky tabs along their chest and limbs, or arms and legs, and their body and the machine will be connected by wires, but absolutely no electricity will be going into their body. And the actual test itself only takes a few seconds, and it's the setup that takes the most amount of time. You're going to enter their data into the machine, into the electrocardiograph, and you always want to turn so that you're facing the patient, and you can verbally confirm all data with them as you're entering it. You're going to have the patient remove clothing from the waist up, and provide female patients with a gown or cape. Or, as I said, if they have a button-up shirt, they can leave that, they can unbutton it. And the gown or cape should open in the front so that you can access where you need to put the chest electrodes and leads. You're going to ask the patient to remove their shoes, but they can leave their socks on. And the lower leg must be uncovered and easily accessible. That's why restrictive pants, socks, and tights are not easy to get around. Might have to remove those. And you're going to have them remove all jewelry and electronics. So watches, belts, keys, cell phones, and pockets. These can all cause electrical interference. I've also found that patients' glasses can do that as well. So you might have to have them take those off as well. If they don't have a purse or a bag that they can place those items in, you can put a towel down on an exam room counter and have them place everything there so that they can see it. You're always going to make sure you ask if they have any questions before proceeding, and ask if they need to use the restroom, because if they have to go really bad, they're not going to be relaxed and comfortable during the test. You're going to offer them the option to lay down and pull out the footrest if they're on an exam table. Offer pillows to support their head and feet, and offer a blanket to provide warmth if they're cold, and especially if they're half undressed. And you're going to allow them time to undress. So you might have to assist them into the supine position, which is laying down flat on the back. And you're going to properly drape the patient to prevent exposure so that they are not uncomfortable. The arms and legs must not dangle off the table. So you're going to make sure they have their arms at their side and that they're not hanging off the table, and put out the footrest so that their legs aren't dangling off the table. This will prevent artifacts. Patients who have back pain or difficulty breathing laying down flat can be placed in the Fowler's position. That is this one right here, which is with the back of the table up and the patient's back at a 45-degree angle. Before running the test, you're going to ensure that the patient is comfortable. You're going to ask them to relax and lie still, but breathe normally. A lot of times people will try and hold their breath while they're taking the test, and that is not going to give you a good result. So remind them to just breathe normally, and they should not be talking. So sometimes you have to tell patients, please hold off on talking for now. I'll be happy to answer your questions after the test is complete. So hairy areas may need to be shaved, and that's only if you're having difficulty getting the electrode to stick onto the patient's skin. So it's not something that we do routinely anymore, but sometimes it is necessary. You oftentimes will clean the placement areas with a skin prep pad ahead of time before placing the electrode on. So depending on your site's policy, you might use something like a benzalkonium chloride antiseptic towelette. Some people use alcohol. There's kind of conflicting data on whether or not that might actually interfere with the electrical impulse transmission through the electrode. So I'm going to leave that up to wherever it is that you're working and performing the EKG, whether they're going to have you prep the patient or not and what they're going to have you use. You're always going to want to start with the arms and legs first and explain to the patient why you're using the skin prep pad and warn them that it might be cold. And this kind of shows them what to expect before you put the electrodes on and the leads. So 10 electrodes are placed all over on the limbs and chest. 4 of them are on the limbs, so 2 on the arms and 2 on the legs. You're going to place the limb electrodes first. I usually place them on the fleshy parts of the upper arms, and then on the fleshy part, kind of on the calf, on the lower legs. And the tabs of the electrodes should always be facing the belly button. So if you're placing them on the arms, the tabs should be facing downward. And if you're placing them on the legs, the tabs should be facing upward. You're going to put 6 electrodes on the chest, and these are placed at very specific points along the chest. And the tabs should be facing downward toward the belly button. And you're always going to ask permission before you touch a patient at all, especially on the chest area. And you're going to explain to them why you need to do this using non-medical terms. So you're not going to say, I need to palpate you or anything like that. You're going to ask, is it okay if I feel around on your chest so I can find the right place to put the electrodes? So the limb electrodes, a little bit more flexible as far as the placement. Okay, we talked about even ankles or wrists, or it could even be upper shoulder if you needed to for some reason, or even upper thigh, but ideally calf and fleshy part of the arm. So the leads will be labeled. So you'll have one labeled LA for left arm and one RA for right arm. Another one will be LL for left leg, and another one will be RL for right leg. The right leg is the grounding electrode. Okay, see how that one's green here? Right leg. So that means that it's never actually used for the EKG tracing. So it's never actually transmitting electrical impulses to the machine. It is simply there to have an exit point for the electricity in the case of some sort of electrical surge, that the patient does not get electrocuted. So it is absolutely necessary to have the right leg electrode and lead hooked up to obtain the tracing, but you should know that that is the grounding electrode. Again, you're going to apply the limb electrodes first, right arm, right leg, left leg. Okay. And like I said, those don't have to be exact. Usually we put it on the fleshy part of the calf muscle and the outside of the upper arm. But sometimes the patient might have things going on anatomically or could have an amputation, and that might not be possible. So you can be flexible with the limb electrode placement and work around the patient's specific situation. But yes, that is my preferred placement for leg electrodes, not directly on the shin bone, okay, because bone is not a good conductor of electricity, but muscle is. So just medial of the shin bone on the most fleshy part. Also, if you can get it on the side here, they might have less hair to interfere. The 6 chest electrodes are also often known as the precordial leads, and they are called V1, V2, V3, V4, V5, and V6. And these electrodes must be placed at their specific correct locations in order to get an accurate tracing, and they must be placed in the right order. So this is going to be your map for the chest electrode placement. I'm going to take a quick pause there before we talk about that. Okay, we're going to pick back up here with the chest electrode placements. Oh, whoops. There we go. V1 goes in the 4th intercostal space, just to the right of the sternum. So that'll be the patient's right. Usually you'll be looking at them opposite, so it'll be to the left of the sternum from your view. It's the patient's right. V2 goes directly across from that in the 4th intercostal space, right? The intercostal space is in between the ribs. So we have the first space, right? First rib goes underneath the collarbone, right? First rib, first space right below it. Second rib, second intercostal space right below it. Third rib, third intercostal space. Fourth rib, fourth intercostal space here. So in the 4th intercostal space, just to the patient's left of their sternum. V3 goes midway between V2 and V4. V4 goes in the 5th intercostal space on the left mid-clavicular line. So you're going to locate the clavicle on the patient's left side, right? And you're going to find the sternal notch, and you're going to find the acromion process, and you're going to then locate the middle, so the mid-clavicular line right in the middle, and you're going to just draw an imaginary line down until you hit the 5th intercostal space. That's going to be V4. V5 goes in the 5th intercostal space on the left anterior axillary line, midway between V4 and V6. And V6 goes also in the 5th intercostal space in the left mid-axillary line. So mid-axillary would be finding the center of the axilla or the armpit and then drawing a line down from the middle there. And you'll notice that it kind of makes a little C curve here around the patient's heart, because even though all 3 of these are in the same intercostal space, the ribs curve around the chest, right? Okay, when you're charting the EKG here in the lab, you're going to make sure you put the date and time, the test that was performed, and here we're going to be doing 12-lead EKG, any observations or patient reactions, and who the report was given to, and then your sign-off. So your name and your credentials. So first initial of your first name, your last name, comma, and then you will be SMA for student medical assistant. Caring for the EKG machinery. So when you're done, you're going to make sure you clean it with a soft cloth and mild detergent if it got soiled. That would be to remove any surface dirt and dust. You're not going to use any commercial solvents or abrasives because that may damage the finish of the machine. You're going to clean the lead wires and the cables and the power cords regularly with a cloth moistened with disinfectant cleaner. Never immerse the cables in cleaning solution as they are electrical. Inspect the cables frequently for cracks or fraying and replace if needed. We do have extras here in the lab. If any of them, sometimes the casing will crack open. And you're going to check and clean the clips after each use. So you're going to clean them with an alcohol wipe because gel from the electrode can interfere with the transmission. And you're going to be sure that the clips fit snugly on the metal tip of each wire. Okay, we'll take a break there and pick up back with Holter monitors on our next lecture.